A major step towards endemic living in Singapore. The country's COVID-19 task force has announced a significant easing of restrictions to 4 of its 5 parameters. The new rules take effect from next Tuesday. First, the limit on group sizes will be lifted. Currently, groups can only have a maximum of 10 persons. This requirement will soon be removed, even for mask-off activities like sports. The cap on the number of unique visitors per household, that will also be lifted. Next, safe distancing will no longer be required. And this applies to between individuals as well as between groups. Vaccination-differentiated measures will also be removed from all settings except one. It will remain in place for higher risk environments. Now, these are events with more than 500 participants at any one time. Nightlife establishments with dancing among patrons and food and beverage establishments, including restaurants, coffee shops and hawker centres. At the same time, the use of TraceTogether and SafeEntry will be stepped down. They will no longer be needed at most venues come Tuesday. Workplace requirements will also be relaxed. All workers will be able to return to the office, up from the current limit of 75%. Mask-wearing mandates in workplaces will also be adjusted. Workers can now remove their masks in the office as long as they aren't physically interacting with others or in customer-facing areas. And lastly, capacity limits placed on larger settings in events will also be removed. Currently, masks on events that have more than 1,000 people are subject to a limit of 75%. That being said, the capacity limit will continue to apply to nightlife venues with dancing.
Well, the moves represent significant steps in Singapore's return to normalcy, but the pandemic task force has also urged vigilance and personal responsibility in the face of potential uncertainties. Sherlyn Xia has more details on what the lifting means and what it's taken to get to this point.
The task force has called it a major milestone towards living with COVID-19, or in the words of the health minister, also a happy day to make these announcements. After all, it has been over 2 years of numerous restrictions since entering circuit breaker and the initial panic buying to the calibrated easing and occasional tightening of measures. And with these latest moves, we will soon be able to breathe a bit easier. The task force says this new posture is expected to last for some time, perhaps several months, if the situation stays stable, but they're emphasizing that the danger is not over.
I have earlier described a pandemic with rising cases like riding a bicycle downhill. It just goes faster and faster, and we need to apply the brakes until we land at the safety zone. I think we have landed in a safety flat ground now, but keep on pedaling. If not, the bicycle will stop and you will still fall. But we are now in a good position. Flat ground, stable, steadily improving. Third thing is, notwithstanding all this improvement and that our bicycle is on the flat ground, we still need to be alert to risk over the horizon.
And as for what risks these are, one is the potential resurgence of Omicron as seen in some places like the US because of the BA2 subvariant. But for Singapore, it's actually less of a concern because our recent Omicron wave was already largely due to that particular subvariant. However, there still remains the most worrying risk, and that is if a new variant of concern does emerge. The task force has called it a potential curveball that could put Singapore back to square one, which could mean the return of contact tracing and entry checks. And that's exactly why they're reiterating once again and calling for all to remain vigilant.
With these changes, we can now have a well-deserved breather after 2 very difficult years of fighting the virus. But let's always remember, we are getting closer to the finish line, but the race is not over, and the pandemic is certainly not over. A new variant will emerge sooner or later, as you heard just now from Minister Ong and DMS. No one can predict what this next variant will be, and if need be, we may very well have to tighten our restrictions or reinstate TraceTogether and SafeEntry.
The ministers also each took turns to thank everyone for doing their part to help Singapore reach this stage, especially the healthcare workers who've been working the hardest and other frontline workers for keeping things going all this time.
At healthcare institutions, fully vaccinated patients will be allowed to have visitors who also have to be fully vaccinated, but hospitals may still impose their own measures, including pre-registration to restrict the number of visitors per patient at any one time. Now, other rules, such as allowing visits to take place within defined hours, will continue, but there will be flexibility to provide exemptions, like for patients who are critically ill. People are encouraged to self-test before their visit. More patients with non-COVID illnesses will also be allowed back into hospitals for treatments and reviews. Hospitals will prioritise patients based on the severity of the patient's condition and the need for more urgent treatments.
More travel restrictions will be relaxed from Tuesday. All fully vaccinated travellers and non-fully vaccinated children aged 12 and below entering Singapore via air or sea checkpoints will no longer need to take pre-departure tests from the 26th of April. Entry requirements for non-fully vaccinated travellers remain unchanged. Separately, cross-border bus services and taxis between Singapore and Johor Bahru will resume from the 1st of May, nearly 2 years after operations were suspended due to the pandemic.
Singapore is downgrading its disease outbreak response system condition, or DORSCON level, to yellow from orange. The framework, coded in 4 colours, provides an indication of the current disease situation. It helps the government put in place prevention and response plans. There are 4 statuses: green, yellow, orange and red. Red indicates that disease is severe and spreading widely. Singapore raised the risk level to orange on the 7th of February in 2020 with the presence of unlinked coronavirus cases. Orange means the disease is severe and spreads easily but is contained. The SARS outbreak back in 2003 is an example. Now, yellow, it means that the disease is spreading but is contained and typically mild, except in vulnerable groups. There is minimal disruption to daily life. The 2009 H1N1 outbreak is one example.
When we raise the alert status, some of the actions have to be taken, including putting aside beds to be ready for COVID-19 cases, raising the alert level of the agencies, putting in place the emergency response teams within the various agencies. And in order for us to allow some of these agencies to get back to their normal mission, to be able to run their normal operations on a more sustainable basis, we will need to therefore to adjust the DORSCON level to allow them to step down their alert status so that it's more sustainable.
The expert committee on COVID-19 does not recommend that those aged between 60 and 79 get a second booster shot. However, they can take the jab if they wish. It should be administered about 5 months after they receive the first booster. Brandon Tanoto with more.
Now, these second boosters are currently recommended for those aged 80 and above, residents of aged care facilities and the medically vulnerable. About 17,200 seniors, or about 30% of those eligible, have already taken their second boosters within 2 weeks of the committee's recommendation. And as for those who are not recommended for the second boosters but would still like to do so, Director of Medical Services Kenneth Mark advises them to consult a medical doctor for a risk assessment.
It may very well be that a person is less than 70 years of age but has risk factors that render that individual medically vulnerable, and indeed such an individual would still be eligible for the booster vaccinations based on our recommendations. But for everyone else, this is a risk-based discussion and conversation. If that particular individual still wishes to get vaccinated, that can be provided within the private vaccination program or the private vaccination clinics, but it would not be offered within the national vaccination program, nor would it be part of the recommendations. So if such an individual does do so, that would be done at cost. It would not be provided free of charge. And if there were adverse effects that arise from a vaccination that was actually undertaken by choice, then this would not be eligible for vaccine financial assistance support.
Meanwhile, Health Minister Ong Ye Kung says there are factors to consider when deciding whether to proactively roll out a second booster. This includes whether subsequent Omicron or new variant waves break out in other countries. When that happens, the second booster will then be rolled out before the new wave surfaces here. However, Mr. Ong added a different response strategy may be needed if the new variant is more dangerous than the Omicron variant.
So it is entirely possible that we have a variant of concern in future that's more deadly than Omicron and also more transmissible. And if it is both, we will then face a worst case scenario. We may then need to hunker down for 6 months or more while scientists develop a new variant-specific vaccine. And this is one of the worst case scenarios that we need to be psychologically prepared for. MOH will continue to work with our international counterparts to closely monitor the emergence of new variants of concern.
Separately, a booster dose is now being recommended by the Health Ministry for those aged 12 and above. And from 1st June, those who had a previous COVID-19 infection will need to get a booster within 9 months of their last vaccination.
Those with chronic diseases such as end-stage kidney disease and respiratory illnesses are encouraged to get their second booster shot, even if they're younger than 80 years old.
Young individual, of course, if they are worried and things like that, they do have the option to go for the booster shot as well. So basically, it's a personal choice at the end of the day. Because as we know that over time, 6 months to 1 year, the antibodies response from your body against the COVID virus would wane over time. And that will put them at risk of catching on the COVID virus again.